This morning, we want to talk about the constant fight for blood donations here in Southwest Florida. As blood supplies continue to decline, your donations are needed. They help trauma centers, they treat cancer patients and people with a variety of other conditions. So this morning, we're talking to Jeremy Puckett with the Blood Center at Lee Health. Good morning, Jeremy. Thank you so much for helping us this morning and joining us.
Good morning. Thanks for having me on.
So, of course, the first question we want to ask is, why is there such a huge shortage of blood right now? Is this pandemic related?
So we've seen a shortage over the past few months. Some of it pandemic related because we're not having our large blood drives that we normally have. But also going forward, we're going to see our shortages because all of our snowbirds have left and gone back north. So we always seem to fall a little low in the summertime months. So we're asking for the people that are here regularly to find a location or a blood drive and come out and donate.
Another question I had is, I actually had a friend who over the weekend went and donated blood, but they weren't collecting his plasma. Why is that happening? Why are blood banks right now collecting less plasma?
So Lee Health has stopped the convalescent plasma program. Main driver for that is that we haven't been using the product. There were a lot of requirements that were placed on use, and a lot of people aren't meeting those requirements as far as early diagnosis, and you had to be hospitalized. So with that usage going down, we had decided to close the program down. If for some reason something happens and they want to start it back up, we're more than willing to get it rolling again. Would be a simple project for us. But right now, our biggest focus is on that shortage of blood products that are out there.
And for anyone who's sitting at home right now and thinking, I wonder if I'm able to donate, who can donate blood, and are there any kind of restrictions to blood donations?
So the big thing we say is the age requirement's always a question. There's no upper age limit as long as you can pass the mini physical and the donor history questionnaire. We need you to be at least 16 years old. We can get parental consent to have you donate. Everybody else, it's really on a basis of what medical conditions you have, underlying conditions, things like that. If you have a question, you can always call one of the donor centers, find us online, give us a call. We can talk with you over the phone, let you know if there's something obvious to us that would prevent you from donation. Otherwise, just come in, take a few moments, go over some things with you and try to get you in the donor bed.
That is awesome. And I remember, just a few minutes ago, we were chatting during the commercial break, and I promised you this interview would be quick and painless. And you said that is exactly how the blood donation process is. It doesn't take too much time. It's not painful, right?
Correct. We want to try to alleviate those fears for you. As far as time goes, I would tell you to book 45 minutes out of your day. The actual donation is only going to take you less than 10 minutes. But we do a mini physical where we check your blood pressure, your pulse, your temperature, and we do a finger stick to get your hemoglobin. And then you have the donor card that you have to fill out. Those are probably the two longest parts of the entire process. We'll get you some cookies, some drinks, and a nice gift. So come out and help shore up these supplies.
Absolutely. Thank you so much for joining us this morning. We really appreciate it. And for anyone at home who's able to, get out there and donate some blood.